Good morning, students. Welcome back to Pharmacology Made Simple. In today's class, we will be discussing about the bioavailability, bioequivalence, and the distribution of the drugs. All these topics are under the pharmacokinetics, which we have seen in the previous class. Coming to bioavailability. Bioavailability is the fraction of the drug that reaches the systemic circulation following administration by any route. Thus, for a drug given intravenously, the bioavailability is 100%. On IM or subcutaneous injection, drugs are almost completely absorbed, while by oral route, bioavailability may be low due to incomplete absorption and first pass metabolism. So, what is bioavailability? It is the fraction of the drug which reaches the systemic circulation following the administration by any route. So in transdermal preparations, they are absorbed systemically and may have 80 to 100% bioavailability. In fact, all the 10 factors which influence the absorption of a drug also alter the bioavailability of the drug. So here you can see the image of the drug bioavailability. So it depends on the plasma drug concentration and the time. Okay, so the time of maximum concentration of a drug could be around half an hour or 1 hour, and for how long it will remain in the maximum drug concentration also can be checked in the bioavailability. Next, coming to bioequivalence. Comparison of bioavailability of different formulations of the same drug is the study of bioequivalence. So once again, comparison of bioavailability of different formulations of the same drug is the study of bioequivalence. So often oral formulations containing the same amount of a drug from different manufacturers may result in different plasma concentrations. That is, there is no bioequivalence among them. Such differences occur with poorly soluble, slowly absorbed drugs mainly due to differences in the rate of disintegration and dissolution. Next, coming to the distribution of the drugs. So first we have seen about the absorption, next is the distribution. After a drug reaches the systemic circulation, it gets distributed to other tissues. It should cross several barriers before reaching the site of action. The various factors determine the rate and extent of distribution, that is, lipid solubility, ionization, blood flow, and binding to the plasma proteins and cellular proteins. Unionized lipid soluble drugs are widely distributed throughout the body. Next, we will see the factors which affect the distribution of the drug. The first one is plasma protein binding. On reaching the circulation, most drugs bind to plasma proteins. Acidic drugs bind mainly to albumin, and basic drugs to alpha acid or glycoprotein. The free or unbound fraction of the drug is the only form available for action, metabolism, and excretion, while the protein bound form serves as a reservoir. The extent of a protein binding varies with each drug. Example, warfarin is 99% and morphine is 35% protein bound, while the binding of exothusamide and lithium is 0%, that is, they are totally free. Here we see an image of the plasma protein binding components. So we see that there are drugs which are the protein free in the protein free compartment, and there is the semi-permeable membrane, and initially in the plasma, the protein containing compartment. Here we see that the drugs or the compounds are getting attached to the plasma proteins, then only they are going into the semi-permeable membrane and it gets released in the protein-free compartment. So for the easy travel of the drugs through the membranes, we require the plasma protein binding substances. Next we see tissue binding. Some drugs get bound to certain tissue constituents because of special affinity for them. Tissue binding delays the elimination and thus prolongs the duration of action of the drug. For example, lipid-soluble drugs are bound to the adipose tissues. Here we have a table of the tissues and various binding drugs. For example, in the adipose tissue, the drugs which get bound are thiopentone sodium and benzodiazepines, whereas in the muscles, emmetine, in the bone, tetracyclines and lead, in the retina, chloroquine, and in the thyroid, iodine. So when these tissues bind the drugs, there will be the specific action of the drug on the specific tissues. Redistribution. When some highly lipid-soluble drugs are given intravenously or by inhalation, they get rapidly distributed into the highly perfused tissues like the brain, heart, and kidney. But soon they'll get redistributed into less vascular tissues like the muscles and fat, resulting in the termination of the action of these drugs. The best example is the intravenous anesthetic thiopentanol sodium, which induces anesthesia in 15 to 20 seconds, but the effect ceases in 5 to 15 minutes due to the redistribution. Okay, so the action of the drug will be at its peak when it is getting perfused in the highly vascular tissues, but once it gets redistributed, there will be the termination of the action of these drugs. Next, coming to the blood-brain barrier and placental barrier. The blood-brain barrier, there are endothelial cells of the brain capillaries and they lack the intercellular pores and instead they will have the tight junctions. Therefore, for the drug to pass through these tight junctions, it will be very difficult. Moreover, glial cells envelop the capillaries and together these form the blood-brain barrier. Only lipid-soluble unionized drugs can cross the blood-brain barrier. The barrier is weak at some areas like the CTZ, posterior pituitary and parts of the hypothalamus and thus allows some compounds to diffuse. Whereas in the placental barrier, lipid-soluble unionized drugs readily cross the placenta, while lipid-insoluble drugs cross to a much lesser extent. That is why even to take the drugs during the pregnancy, the doctors will suggest to avoid most of the drugs during the pregnancy because it is the drugs have a high chance of crossing the placental barrier and affecting the baby. Here we see the image of the blood-brain barrier. You can see there are tight junctions and only water-soluble agents are crossing from the blood-brain barrier into the brain, whereas in transcellular or lipophilic pathway, lipid-soluble agents easily cross to the blood-brain barrier, whereas in the transport proteins, glucose, amino acids, and nucleosides, there will be the protein binding receptors, and the drugs will get bound to them and will pass through the semi-permeable membrane and reach to the brain. Whereas in receptor mediated transcytosis, again there will be the receptors to which the drugs such as insulin and transferrin will get attached. Then it will form a membrane around itself and cross through the barrier, and once it reaches the brain, again there will be the opening of the membrane and the receptors will release the drug. Whereas in adsorptive transcytosis, the binding agents are albumin and other plasma proteins. The drugs or the compounds will get bound to them, and again it will form a membrane around itself, cross through the blood-brain barrier, and later it will get discharged into the brain. This is about the blood-brain barrier. So these are the various factors which were affecting the distribution of the drug. Now we also need to know about the volume of distribution. The apparent volume of distribution is defined as the volume necessary to accommodate the entire amount of the drug administered. Okay, so what is it? It is the volume necessary to accommodate the entire amount of drug administered if the concentration throughout the body were equal to that in plasma. Therefore, Vd is equal to amount of drug in the body by the plasma concentration. Okay, to understand this better, we'll take an example. So for example, if the dose of a drug given is 500 mg, it attains a uniform concentration of 10 mg per liter of the plasma, then its Vd will be equal to 50 liters. Okay, so you can put the values in the formula and then you can calculate. You will get Vd is equal to 50 liters. Okay, so if you put the values, it will be Vd is equal to 500 divided by 10 mg per liter, which is equal to 50 liters. Okay, so hope this is clear, students. This is about the bioavailability, bioequivalence, distribution of drug, the various factors which were affecting the distribution of the drugs, and also we learned an important formula, that is what is the volume of the distribution of the drugs.